let us look at introduction. The mammalian respiratory system is a vital physiological component that ensures cellular survival by providing a continuous supply of oxygen for ATP production via the Krebs cycle and electron transport system, while efficiently removing carbon dioxide as a metabolic waste product. This complex process relies fundamentally on simple diffusion across a respiratory membrane that is thin, moist, and possesses a large surface area closely aligned with a vast capillary network. However, any structural or functional disruption within this pathway, such as the hyperresponsiveness seen in chronic conditions like asthma, can severely compromise homeostatic balance by drastically increased airway resistance. This presentation will examine the physics and mechanics of normal mammalian ventilation alongside the acute pathophysiological shift that occur when the airway function is impaired. Moving on to our next slide, let us look at the mechanism of normal respiration focuses on three basic processes. First, pulmonary ventilation or breathing, which is the physical, mechanical process of inspiration, meaning inhalation, and expiration, meaning exhalation, sets a chain between the atmosphere of the alveoli of the lung. Second is external respiration, which is the action of gas at the pulmonary level, where blood in the pulmonary capillaries gain oxygen and unload carbon dioxide across alveolar membrane. And third, we have internal respiration, which is the gas action taking place at the systematic tissue level, where capillary blood release oxygen to body cell and absorb cellular metabolic waste carbon dioxide. Next, mammalian ventilation physiology, specifically on negative pressure breathing. First, for the core mechanism, mammal ventilation their lung via negative pressure breathing, a mechanism that functions by pulling rather than pushing air into the lung without conscious effort. Second, regarding the natural control center, the regulation of this dynamic process is governed automatically by the respiratory centers located in the brainstem, which are the medulla oblongata and the pons. And third, for hemostatic monitoring, the brain continuously monitor blood pH and carbon dioxide concentration. During exercise or high activity, rising CO2 level triggered the medulla to increase the rate and depth of respiration to restore homeostatic balance. Moving on our next slide, let us look at the official airflow rate and how Boyle's law govern our breathing mechanism. First, as outlined in our lecture note, the official route of airflow during inhalation follow a strict pathway, starting from the nostril, moving through the pharynx, epiglottis, larynx, trachea, bronchioles, and finally reaching alveoli. This mechanical movement of the air Boyle's law, where gas pressure and volume are inversely proportional. As we can see, our ventilation is divided into two distinct phases. During inspiration or inhalation, our external intercostal muscle contract, causing the rib cage to expand upward and outward. At the same time, the diaphragm contract and move downward, flattening out. This action increases the thoracic lung volume, which drops the internal air pressure below atmospheric pressure. This creates a negative pressure that pulls or sucks fresh air into the lung. On the other hand, during expiration or exhalation, the respiratory muscle relaxes. The rib cage gets smaller as the rib muscle relaxes, and the diaphragm moves upward, returning to its dome shape. This decreases the thoracic volume, which increases the external pressure above atmospheric pressure, successfully forcing the stale air out of the lung. Next, here we will examine the characteristic of the respiratory membrane and the primary lung volume that quantify our breathing mechanism. First, regarding our alveolar diffusion efficiency, the air entering the alveoli dissolves completely into the moist film lining, the inner surface. It is then rapidly diffused across the thin epithelium directly into adjacent capillaries, while carbon dioxide diffused in the opposite direction. Next, to analyze how much air our lung can hold and move, we look at the three specific lung volume and capacities from our notes. First is tidal volume, which is the volume of air exhaled and inhaled by individual during each breath at rest, meaning when no extra physical effort applied. Second is residual volume, which is the critical volume of air left trapped inside the lung even after forcefully exhaled, preventing the alveoli from collapsing. And third, we have vital capacity, which represents the maximum volume of air an individual can forcefully expire after taking their deepest maximum inspiration.
This slide shows an asthma attack. It can be triggered by dust, pollen, bad dander, cold air, or exercise. During an asthma attack, the airway becomes narrower due to muscle contraction, inflammation, and excess mucus. This makes it difficult for air to flow in and out of the lung. Asthma can be treated using rescue medication, such as salbutamol for quick relief and inhaled corticosteroids for long-term control. In conclusion, the mammalian respiratory system is essential for maintaining life by supplying oxygen and removing carbon dioxide from the body. Normal respiration depends on efficient ventilation and gas exchange in the alveoli. However, airway dysfunction, such as asthma, can disrupt this process through bronchoconstriction, inflammation, and excessive mucus production, leading to breathing difficulties. Therefore, understanding the mechanism of normal respiration and airway disorder is important for improving respiratory health and ensuring effective treatment and management.